Poverty grips roughly a quarter of our population. 1 in 5 Ugandans lives in extreme poverty, surviving on less than $1.90 a day. These are not mere statistics, but reflections of millions struggling to meet basic human needs. The other challenge is gender disparities. Poverty in Uganda has a predominantly female face. The Uganda National Household Survey reveals that female-headed households experience a higher poverty rate, 22%, compared to male-headed households at 19.5%. This stark disparity underscores the urgent need for targeted social protection measures to empower women and girls. The other is vulnerability to shocks. Without robust social protection systems, our people remain vulnerable to economic downturns, health crises, and natural disasters. The absence of safety nets exacerbates inequality and stifles sustainable development. The last of the challenges that we've named is economic inequality. The gap between the rich and the poor continues to widen, threatening social cohesion and undermining trust in institutions. And we need to constantly remember that when they are not safe, no one is safe. What is our call to action? Social protection is not just a policy preference, it is a moral imperative and a catalyst for sustainable development. We stand at a critical juncture where decisive action can transform lives and propel our nation toward a more equitable future. At ICRW, our work is anchored on 4 major themes. One is women's economic opportunity and security, health, including sexual and reproductive health rights, equitable social norms and power dynamics, and climate action. Through these pillars, we seek to understand and address the root causes of inequality, developing solutions that can be applied at policy, institutional, community, and individual levels. We believe that gender transformative livelihoods are not only essential for development, but also beneficial for society as a whole. Your presence here today signifies a shared commitment to addressing these urgent challenges. Together we have the expertise, the influence, and the responsibility to make meaningful change. This pivotal event is more than just a discussion, it is a catalyst for action. We must collaboratively identify gaps, harness opportunities, and implement solutions that will strengthen social protection systems in Uganda. I urge each one of us to engage actively, share insights, and forge partnerships. Let us work together to ensure that social protection becomes a reality for all Ugandans, especially the most vulnerable. I welcome you and thank you for coming today.
All right, welcome back into the room. If you haven't had tea, you had Jackie. They're going to feed you until we close this session. So please pick a cup of tea outside. We're going to get into a panel discussion. So I'm going to invite our panelists to come and sit at the front. And I'm going to start with Mercy Munduru Grace. And as she walks here, I'll tell you a bit about her. She's a human rights lawyer and activist, currently serving as the head of programs and fundraising at Action Aid International Uganda, where she oversees the country programs anchored on supporting people's struggles for social justice. She has previously led work on women's access to gender justice, governance, community mobilization, and awareness to challenge patriarchy and advocacy for gender-inclusive policies within Uganda and the Great Lakes region of Africa. She has served at some of the pronounced civil society organizations championing gender justice, notably the Uganda Association of Women Lawyers, FIDA Uganda, Mentoring and Empowerment Program for Young Women, MEMPRO, Uganda, and Refugee Law Project and Masiko International in Uganda. Mercy is also one of those people that, it's not on her CV, but West Nile didn't have electricity for a while. And Mercy was on the street saying, we want electricity, we want to be on the grid. Why do you ignore Arua? So, Mercy, welcome to the panel. The next person I'll introduce, thank you. The next person I'll introduce is Grace Nshemire Gwaku. I don't know if Grace is in the room. Oh, Grace, great. Grace is the Chief Operating Officer at Private Sector Foundation Uganda, the Regional Head of International Premium Spirits at East African Breweries Limited Kenya, looking after Kenya, Uganda, and Tanzania. This is previously. In all her capacities, these are the things I'm going to read after. Right now, she's the Chief Operating Officer at Private Sector Foundation Uganda. So previously, she was the Regional Head of International Premium Spirits at East African Breweries Limited Kenya, looking after Kenya, Uganda, and Tanzania. Global Marketing Manager, Guinness, Malta Guinness, and Origin at Diageo London. United Kingdom Managing Brands, these brands across the African continent. She was the Marketing, Innovation, and Customer Marketing Director at Uganda Breweries Limited. She was the Regional Marketing Manager at Unilever South Africa, based in Durban, looking after West African countries like Nigeria, Ghana, CDI, Cameroon, etc. She was also the Regional Marketing Manager at Unilever Kenya Limited, looking after 7 countries: Kenya, Uganda, Tanzania, Malawi, Zambia, Zimbabwe, and Mozambique. Welcome. My next panelist is Moses Segawa, who is an advocate at the High Court of Uganda and partner at S&L Advocates. Moses is a specialist employment and employee benefits practitioner. He advises on both non-contentious and contentious matters across the entire value chain from recruitment to termination. In addition to routine advisory support, Moses possesses notable expertise in specialized matters such as transfers of undertaking, corporate restructurings, and labor law compliance audits. Moses' non-profit practice advises sovereign donors, multilateral agencies, implementing partners, social impact organizations, and international non-government organizations on corporate registration, regulatory compliance, and tax planning. Moses, I can read that again so that it gets you out of your seat. Okay. I know we're expecting Honorable Flavia Kabayenda, but I know she's not yet here. I'll introduce her if she does come in. So then let's go to Fred Muhumza, who holds a PhD in Development Economics from the University of Manchester, a Master's in Economic Policy and Planning from Makerere University, and a Certificate in Development Evaluation by Carleton University and World Bank. He is a senior lecturer at the Makerere University Business School and the director of MOOB's Economic Forum. He has an experience of over 30 years in development policy research and analysis with a parallel teaching career at various universities, including Makerere University, Chambogo University, Gumba University, and African Bible University. Fred, I did not know about the African Bible University. He conducts policy and institutional analysis, strategic planning and training for the public and private sectors, civil society and development partners. He is a member of the boards for Habitat for Humanity Uganda in the African Forum and Network on Debt and Development based in Harare, and the International Center for Research on Women. He has previously served on the boards of Bank of Uganda as the chair, World Vision Uganda as the chair, Vision Fund Uganda, Scripture Union of Uganda, Uganda Christian University, Bank of India Uganda, and Post Bank Uganda. Welcome, Fred. And finally, for now, Paul Onapa, who is a senior social policy and development professional with over 19 years experience in leading multilateral organizations. He has extensive experience in supporting innovative policy and planning processes, such as development of the National Social Protection Strategy for Uganda 2024, mainstreaming social protection in the development of the National Development Plan 3, development of the Ministry of Gender, Labor and Social Development Strategic Plan 2021 to 2025, and rollout of the cash transfers to vulnerable persons affected by the COVID-19 containment measures 2021, building capacity for social protection and social policy research, analysis, and evaluation. Paul's CV goes on and on. I will stop there because I did not come with a glass of water, and I need to be able to speak after. So this panel discussion is a little different from most of the panel discussions that I've participated in. The panelists know what they're going to speak about, and they've been specifically invited to speak about areas that they're very conversant with and are working with on a daily. So you can see we have government, we have private sector, we have legal, we have civil society, we have everybody represented. So we're going to just get into what each of them is going to speak about. Paul will be speaking about the state of social protection in Uganda, focus on policies, programs, and their effectiveness in addressing the needs of vulnerable populations. So Paul, we'll start with you. You have a microphone right next to you. And unless you want me to ask you a leading question, I'll allow you to just, do you want a leading question? Or you'll just speak freely? Please speak freely to the policies, programs, and their effectiveness in addressing the needs of vulnerable populations. After this panel discussion, we will then come to the room for any questions or comments that anyone in the room might have.
Thank you very much, Josephine, for inviting me to be part of this panel, and also to ICRW for organizing this event. I will quickly start that last year we launched this report, and this is the state of social protection in Uganda 2024, and it gives a mapping of where we are at in terms of delivering social protection for the poor and vulnerable in our country. And I will note that as a country, we have come a long way to put in place systems, to put in place a social protection system that will protect our poor and vulnerable when they are faced with various risks across their life cycle. Because we know when you're born, you must be an adolescent. After you're an adolescent, you must work, or at least first be a youth. And after you're a youth, you must work or be in a productive life. And then you must be an older person at 60 years before probably you depart this world, if we look at the proper cycle. So along those episodes of life, we do face a number of risks and vulnerabilities. And that is what social protection is about. To put in place systems, to put in place interventions that will help to protect you when you face certain risks and vulnerabilities. So what we have done as a country, starting with the policy framework, we have been able to put in place, one, a social protection policy, and this was in 2015, and this has been supported by the National Social Protection Strategy that, again, we also launched last year, and this is to cover for the next 5 years. But we've also been able to ensure that our planning documents, and especially the National Development Plan 3 and now 4, also inbuild and focus on social protection as a key driver for accelerating human capital development for our country. Of course, these are backed by a lot of legal frameworks that Council will talk about a little later. So in terms of a policy framework, one would say, yes, we are not so badly off. But policy frameworks must be operationalized by interventions. And that is where, again, as a country, we've been able to see some interventions being implemented to support these various communities or various categories of people across the life cycle. So we have seen interventions for children, and especially, I'll just give some light examples. For example, interventions for children, and these are like the NutriCash, which we have, especially in West Nile region, and this is supporting up to about 13,000 children under their lactating mothers. And this is especially to help them address the challenge of malnutrition and stunting, because this is a very, very key issue. But we have also seen interventions, especially for the working age, and this is in terms of supporting them to access social security, and this is for both the social security for the public service, which is reaching about 400,000 civil servants, but also the contributory one for NSSF, and this is for the working population, which is also reaching about 2.4 million people. But when we go to the older persons, that is where we have the social assistance grants for empowerment, where we're supporting all older persons across the country to be able to live a dignified life with some grants, monthly grants that we give to all these older persons to be able to survive. And so far we're reaching about 307,000 older persons. So one would say, yes, something is working. But what is the catch? And here is the catch. The catch is Yes, we have the policies, and yes, we have some interventions, but the operationalization of the life cycle is what is still lacking. And as we said, you move through stages in life. Our intervention should be able to trap you or to provide safeguards that at any one stage in life that you fall into, you are protected. But we don't see that covered. We see, yes, some tits and bits for the children, but what about when you get to an adolescent? What about when you start working? We know that because of the challenges of unemployment, we know that because of the informalness of our sector, most of the people in the informal sector, statistics tell us close to about 70, 80% or even more. But the system we have is configured for the persons in the contributory sector, in NSSF. So that means that the ones who are in the informal sector, when they are faced with challenges like in COVID, we saw there was no fallback position. It was basically slip into poverty and you're on your own. But even when we go to the older persons, we still note the challenge of, yes, you're reaching 307,000, but 8 years. But 8 years, now if you go to my prof who teaches me so much, will tell you, what is the life expectancy? Maybe 70, is about 68 now. 2, what is the retirement age? Maybe 60 years now. So between there, where is the person to wait? So the call for lowering the age has been real and is real, and for us to be able to reach all these people. But beyond the numbers, we talk of the investment. First and foremost, it is the responsibility of government to look after its citizens, not any other person. Now, if it is the responsibility of government to look after its citizens, then it is the government to put in resources to finance social protection. And as we speak, our government only spends 0.7% of our GDP on social protection. But in our opening remarks, our chairperson, Jackie, did tell us the key drivers currently of vulnerability. Poverty is on the rise. Risks and vulnerabilities across the life cycle are on the rise. Even recently, we are seeing that the global challenges in the funding space have driven and sunk many people into vulnerability. We have seen people that have lost jobs. They are now candidates for social protection. We have seen all the vulnerable people who are living on social care support systems, like the persons who are living with HIV and AIDS, the other vulnerable children who are living on support from development institutions that now has been cut, have been sunk into the arms of poverty and now need support. But where is the support? Government is not investing. And that is where the call again for investment is alive. And then lastly is on the issue of, now we are saying that more often, previously we used to have the natural calamities, call them, or the vagaries that used to be a little not regular, but now we're seeing them. We know, for example, now we can predict that there will be a flood. After a flood, there will be a drought. After a drought, there will be a pandemic. You move from COVID. After that, you're going to Ebola. You go to Ebola, you go to monkeypox. We don't know what's coming next. So that means that we need to reconfigure our systems to be shock responsive, so that when the things happen, we can be able to tap and call Ugandans at that point of need. Because if we don't, if you're implementing your programs and you know that there's going to be a drought, and drought has fallen, you cannot reach to the people, then there is hunger and starvation, and then there is death. So reconfiguration of our social protection architecture and systems is a call that we need to do now to make our systems shock responsive and to make them inclusive, to cover the life cycle risks, and also to ensure that all Ugandans are protected to live dignified lives as envisioned by our constitution, that says that it is the responsibility of the state to look after its citizens, and the state will provide affirmative action for the marginalized. I thank you.
Thank you very much. I'm just going to ask you one question. How do we measure the impact of social protection programs in Uganda thinking about poverty, thinking about vulnerability, these climate shocks that you've been speaking about and so on? How do we measure that what we're doing is effective or not?
Thank you. Again, we have done a number of studies, and I'm happy that Prof is here because he's participated in some of them, or he's done a lot of them independently. And these studies have actually shown that the investment in social protection has benefits at household, at community, and at international, or call it national levels. And I will not give you the total sum. I've carried a report here, which we did again last year, which is the investment case for social protection, that does an analysis of the impact of social protection in our country. But let me give you an example of the senior citizens grant, or the social assistance grants, the money that we give to older persons, the 25,000 that we give to older persons on a monthly basis. And I'll give you the impact, then you'll be able to know what investment in social protection translates to. Now, by giving these older persons this money, this is what the data tells us. One, on poverty alone, we registered an 11% decline in poverty among the beneficiaries of the senior citizens grant. And how does this money accumulate? When we give you the 25,000, we give you on a quarterly basis. So every time the person gets 75,000. Now 75,000 is then used to, one, boost the income levels. And that is how, when you go against the money that we touched this morning, they're also able to touch some money and move out of the statistic that Jackie talked about. The people that don't touch anything. Now the older persons touch something. So that is impact number one. The second is, when they touch this money, we know that 26% of older persons look after children. Who are these? They're either grandchildren, they're either orphans and vulnerable children, or the children under their care. And when they touch this money, again, 7% of them were able to recall school attendance increase. So that means that now you're seeing that you have touched the older person is able to take the grandchild to school, and that is also contributing now to the others, which I'll talk about at the national level. The human capital development, the education outcomes, and among others. Now, when we come to, again, this money that we're giving them to touch, when they get this money, they consume it on meals. The nutritionists in the house tell us, at least for you to live, you must consume a minimum of 2 meals a day. Now, a lot of Ugandans, we know, some are unable to even consume a meal a day. So for us, among our beneficiaries, the 307,000 that I talked about, with this money that we give them to touch, the percentage of older persons who were consuming less than 1 meal a day dropped by 7%. So that means that we're able to get more people to consume more than 1 meal a day, and that improves their nutrition outcomes, and then you get healthy Ugandans. But lastly, I will also talk to the impact at a bit of a macro level. When you accumulate this money that we invest in older persons, on a quarterly basis, we give 26 billion shillings. Now, 26 billion shillings across the country is invested within the local communities where these people are. Now, where do they get this? That drives business. We see the business people coming up, the ones who sell, call it food, soap, and other essentials of life. So they are creating employment. But two, it drives the purchasing power and demand for the Ugandans at the community level. And what does the state benefit? When there is purchasing power, there is demand for services, and then the business sprout up, and before you know it, the economies boom. So starting with 25,000, it creates a spiral increase. But again, the case is, you have given 25,000 since 2010. Inflation is real. Can we adjust the value of the grant so that we do not erode the impacts that I talked about in the lives of the older persons, in the lives of the communities they live in, and in our state of the economy that Prof will be talking about later. Thank you.
Thank you very much, Fred. He's actually going to be speaking about it just now, but it's amazing what 75,000 shillings can and will do when you break it down like that. Nutrition, being able to take kids to school, have money in their pockets and so on. 75,000 a quarter? Yes. So we're going to make move on to Fred, who is going to speak about the state of the economy, the gaps and the opportunities in the current social protection system.
Thank you, Josephine, and good morning once again to everybody. As a researcher who sometimes looks across economics, and the economy is just about the people, so we no longer measure, for us who are trying to be people-centric, you don't measure economy by GDP and say it is doing well. America is growing at 2%, Uganda is growing at 4%, so Uganda is better than America. I mean, we've had a lot of that. I don't want to use the word. My mom taught me not to use bad words, but let's behave like we went to school. So we've even gone beyond 2 meals a day. What does that mean? And I'm happy to have a chancellor in Makerere who is a medical doctor. So he has tasked me to say, let's get into the real issues. And I like the report that was produced by the ministry about stuntedness, kwashako, marasmus. So it's not just about eating. How many of these children have kwashako? Now here I was just Googling, you know, these days we have these assistants available to us. What is the calorific requirement for women? And the ICRW were about women and research. And breaks it down by age. On a daily basis, 19 to 25 will need between 2,000 and 2,400 calories. So don't tell me I've had your bananas, your maize. I want to get down to calories because that's what the body needs. It's calories. It doesn't know whether you ate fish or beans. Both of them had proteins in them. So 26 to 30, you need 1,800 to 2,400. And of course, this is also subject to what are these women doing. So a woman like the ones I'm seeing in this room, you may require less calories than your counterpart who is climbing mountains and hills like Jackie did on the Kilimanjaro. But there are women on that hill, that is their life. They stay there, they live there. Look at that boy, after playing football, others are going to have a good cool shower. But I mean, he's there. So we are trying to break down economy in those senses of what does it mean for people. Because that's what economies are about. And then what does the budget promise us? So I can have my 1 meal a day and get all my calories. It may be a big plate, it may just be fortified food. And this is what the researchers have been doing for us. Because we know most Ugandans would just have one kind of food. Potatoes and vegetables. So we try to make sure all the nutritional requirements are inside that potato. Because they don't have a buffet like you have seen out there. Like, there is my proteins in that dish, my starch is in this dish. For them, it's potatoes and beans. So thanks to the scientists, and they have been doing a good job at NARO, to say, can we put some little bit of potassium and sugar and proteins and fat in these potatoes? How do we put everything in that meal that they are going to have? So we want to be judging the economy from that perspective. Otherwise, we have read government documents, and I have issues with my colleagues, where we say Uganda has now 2,500 to 6,500 tarmac roads. What does that tarmac road mean to that woman who can't even walk on that road because she has no dress? So you can now reach Karamoja and from on tarmac. Who is going to Karamoja? How many of us have been to Karamoja? I'm not a gold digger, but I'm mindful about the next school that this child cannot reach. Or when they reach it, they come with an empty stomach. And it can get worse when the teacher is not there. So when you hear that 1.8 million children enrolled in primary one, track that cohort, 1 million have not sat P7. And nobody can answer where they are. We don't know whether they dropped out in P2, P4, P6. Did they die? Where are they? Nobody has information about them. That for me is the state of the economy that is not taking care of those individuals. And sometimes it's not that we don't know what to do, but quite often we just can't do it. And this is where the fundamentals of how do you fix an economy like ours. I was looking at the numbers. We've just released a budget called Circular Number 2, very detailed preciseness of what accounting officers must do. Budget for gender. Make sure there is money in your budget for gender. There is money in your budget for social protection. Make sure there is money in there. But when I get back and then see how have we implemented the budgets of the past, quite often it is zero non-wage release. So you literally have only paid wages to people who do not even have, and I work with non-wage. If I'm a medical doctor, I don't go in the theater to use my head to do an operation. My head will do it, but I need anesthesia, I need switches, stitches, I need all these kinds of things. Without them, I can't even touch the patient. And I've really found that reality with doctors in one of the hospitals in Kitwe. Kitwe is at the border with Rwanda. These doctors said, we can't even do a cesarean section. Something many doctors will do several times over, and they can easily do it. But because we don't have an anesthetist, so we refer to Itojo, which is several kilometers away. Now that cost goes to the household to move this mother from Kitwe to Itojo. And then when you get to Itojo, there is no gynecologist. There is no doctor who does these operations. He comes over the weekend. This was a live story about 5 years ago. We were doing a study with the Uganda Date Network about health sector strengthening systems. This man volunteers. He says, because I benefited from this project, so I volunteer in a government hospital. So Monday to Friday, I'm earning a living for myself. Then Friday to Sunday, I'm serving Ugandans in that hospital. Now, all women must schedule their deliveries. I don't know how they do that. You know, when we're in our other's homes, we just pop up. But if you really have a cesarean section, you must schedule to be there on Friday to Sunday. And now imagine this guy comes and finds 15 to 20 women waiting to have cesarean section. And the hospital doesn't have anesthesia, doesn't have everything. So when he says, please, I am here to serve you free, but I don't have these things that I need in theater. So here is the list. Go and buy them and bring them. Now somebody says, the doctors are asking for bribes. No, he's like, thank you, I was paid. But this one is not even paid. He's just doing his, work. These are complications. How do we find ourselves in this situation? The budget that was released of 66 trillion looks a big budget. But when you break it down, almost 12% of that is going to pay interest. 12 trillion. So it's not available. And in budgeting, we say debt service takes first priority. Even before we find Museveni's salary, we first pay debt. So that 12 trillion for interest payment is not available for 2025, 2026. Amortization, which is the other debt payment for external people, is about 4.3 trillion. You are now on 15. Not available for anything. It's paying debt. Refinancing is almost 10 trillion. Refinancing is, my friend Paul here has asked for his money. I say, you guy, okay, assume I have paid you and you have given it back to me. So today we have settled the other debt. We have a new debt with us. So that one I will pay next week. So for this week, I think I'm okay because I don't need to pay Paul. But I'm also playing around with Paul's money. So it's just, again, it's a book entry. It's not available in the budget. So when you net off those items, you get to over 30 trillion of the 66 trillion budget. So literally only 30 trillion is available. Break that one down. 11 trillion will go to security. And that's when Mr. Museveni now comes in and says, I need security. I will do everything to secure Ugandans. But we are being secured against the thing that the military can secure us against. Not MPOX. And these are the social protection things. These are the shocks. That this child is going to wake up and the mother is possibly sick. And I've seen children, even I teach in university, some of the children who come to ask for a dead year, they are saying, Mom had paid the fees, but now Mom is sick and I'm the only caretaker. So can I ask for a dead year? And we have to grant it, but sometimes now we debate, do we carry these fees? Because this family is struggling, you can see really. Now these are social protection issues. And I'm glad he mentioned how much do we give these individuals who are SAGE. But SAGE, they are the age that are looking at all these Vazukuru. You know Museveni writes about Vazukuru? These guys started, they can't write, but they all have Vazukuru around them. And their Vazukuru are real with them. At least Museveni, he meets them on X. Those Vazukuru he talks about are on X. But these others are physical around this man. This one is crying, this one is dying, this one is what? And the man himself is, you wonder who is going to save who. I remember I went with General Sale one time, we were tracking government programs in Mukono here, not very far away. And I found a program that had given people pigs. They were really hungry, the pigs. And the people were also very hungry. I said, General, one of these days we are going to hear a report that one of these has eaten the other. So either the people have eaten the program, or the program has eaten the people. These are the $7,000 a day. And by the way, 7,000 is 34%. That's the international poverty line of $1.90. When you put that on Ugandan figures, 34% of Ugandans are that poor. If you bring it down to $1, then it is 20%. Now, politically, we like the 20%. So Uganda, we are stuck on the $1 a day. But really, $1 is 3,600. So, Jackie, you raised the bar. Majority of Ugandans, 8.4 million, are on $1 a day. 3,600. That's the Bogoya. For some of you have seen Bogoya out there. That's really where the people are. These are the people we're talking about. Now, in planning, we say, how do you help them? One, I can give them money. But that's not a good way to do things. Simply strengthen the system. One, let them earn their little money, but then make sure the little money they have earned is not spent on things government can cover. So can we have free health care? Because when you look at out of pocket, in our budgeting and strategic planning is 40% of the health budget. So literally you expect Ugandans to come with 40% of the health sector budget from their homes, where it is not. And many people just hang up and die. And people dying of basic preventable diseases. So if UPE was working well, I know people in this room, you have just been spending money, and you are still spending money putting children back in school in millions of shillings. What if this was in the 70s, when people used not to pay any fees? I mean, you just pass, fill in a form, they are used, those forms would shed, and then all of a sudden you see a letter come either through a church, there was no postal address at home level, but either it's a church or the school where you were. And you go and they tell you have been admitted in Gayaza. Now all you need is to get on the Uganda Transport Company bus, and if you're a child, you will get on that bus free. All you need is some uniform. And remember, you're using the uniform of your primary school because you haven't reached Gayaza to get the Gayaza uniform. But they would recognize that anybody in uniform was on the bus free, whether police, military, or children. That's how the system worked for us. Now that for me is a better social protection system. Because the burden of these fellows is not on the parent. Right now I have parents selling the PDM projects to take children back to school. And I've been asking my colleagues, come next year, we'll begin to collect this money back. But should we really? I want as a researcher to see what did they do with the money. If anybody used the money to pay fees, that's PDM. It's pillar number 4. That's where social sector is sitting, education and health. If anybody used PDM, and I'm not saying people should go and not put it in pillar 1, but don't please plant cassava when you have a sick child with malaria. Because by the time the cassava is ready, there will be a grave next to the cassava plant. And that's not how we develop. The human resource is most prime. So we are really in a predicament that I hear him, I hear everybody, but where is the budget? Now we must all begin by saying, how do we create the budget? That was rationalization of government agencies, and most importantly, public expenditure. The PEX was rationalization of public expenditure. I wish we had begun there. And first leave the agencies. They are the smallest part in the problem. The real fly in the soup is the public expenditure. And I've been telling people, I'm now learning from Trump how to draft executive orders. The only thing I'm left with is how do I convince the one who signs on the dotted line to sign my executive orders that I've drafted. One example I would give, wake up one morning and the entire government fleet is frozen by executive order. Pack all of them. One, you would save vehicle maintenance in garages. Some cars go there, by the way, without even being bad. Paul is here. You may find in the records his vehicle is being serviced even when he has it here. That's the corruption. So when you say all vehicles parked, you will save 400 billion. Instant. And then you will save fuel 700 billion. So 1 trillion will be back with us to begin financing the conversation we're having here. By just that one executive order. But who runs X? X is really a good thing. You know, you do those things. My ex. In America, they don't say ex-president. They remain presidents. But the rest of us use the word X. And I remember Jackie's parents telling us in church, please don't say Xmas. Christmas is still relevant, eh? So don't say X. But I need some X in this country. Otherwise, we're going to talk, and the best we'll do, the spirit is willing, but the body is not even weak, it's not there. Thank you.
Fred, I was going to ask you to give us some, to help us think through how we can leverage the current social system that we have, social protection system that we have. But I'm afraid you might just tell me that you want to have an executive order around all of it.
No, we just have a policy. That's the best social protection we have. This man has done his duty and given us a policy. But we can't operationalize that policy. When I look through what is happening is really, and what is needed, is really basics. Last year, I sat with a medical doctor and were raising money to treat their own patient. The doctor works in Mulago, had a patient who needed an operation by his colleagues, and they all agreed and made the budget now. There is no bribe here because they work in Mulago. The guy going to do the operation works in Mulago. But the doctor said, I need the following to work on your patient. And this patient, the operation they were going to do was very complex. So they needed also an ICU. And they said, we need to book it. So let's also raise 1 million to book the ICU in Mulago. If we don't need it, this one will come back. So I sat around, I said, when we hear raising money in Mulago, we think it is a bribe. But here are Mulago people themselves. So where is the social protection? Minus money, you are talking to yourself. And where is the money? But the other social protection, the other day we were discussing with friends, and I remember growing up in the 80s, American missionaries used to come to Hoima, and they had a big book where there is no doctor. Because from America they knew you are going into the jungles, chances are the nearest doctor will be 100 miles away, and Trichy may take you 2 days. So go with this book where there is no doctor. And those books are still available. Please Google and get the latest revised versions. Because a snake might bite you, a mosquito, you get malaria. So where there is no doctor. Now I'm beginning to look at situations where the government is willing but the body is not available. How do you do social protection? And many Ugandans have done these social protection networks of their own. Check your inbox, somebody is asking for money for something. This is the social protection. We survive on social networks. Even circles that were purely for lending have now created a window, the VSLAs, for emergencies. So they will say your daily contribution is 5,000 for development, but bring 1,000 for emergencies. So that when emergencies come, we don't cannibalize our development budget at circle level. But we must recognize helping our people. How has BRAC done it? BRAC is one of my most realistic microfinance and development agencies. And I teach it in university. Any one of my students must do the BRAC model. BRAC would pick money from the philanthropists of this world. To say, I lend money, but I've realized from research, the thing that are failing my borrowers to pay back is not that the business we invested didn't work. But every time it works, money goes into education, money goes into health. Now, either they are not able to pay me back, or when they pay, they can't graduate out of poverty. So can somebody help me and close that open door of health and this open door of education so that I can move these people to their next level? They write that proposal, and thank God they are philanthropists who have given them money. At one point, they gave them $50 million across their network to provide scholarships for every person who has borrowed from BRAC. Because now we are sure school fees will not come to the project. There is a scholarship for you. Then they have invested heavily in community health workers for preventable diseases. Records are telling us 75% of diseases are preventable. But it's not my business as BRAC to do health. But health's failures are encroaching on my space. So let me go and help these people prevent the diseases. So they began financing people in communities to do disease prevention. And at the end of the day, they began to see money remaining in their projects. So when we are designing the PDM, we emphasized each of those pillars. And a friend of mine will be coming back to you shortly before the budget is passed. We are putting the government budget out of your 20 programs, legislature and what, into the PDM pillars. Because we said we need these pillars to support the people. Get your money in pillar 3, invest it in pillar 1. But we must invest in pillar 4, education and health, to make sure these don't cannibalize what you are doing in pillar 1, so that you can move on. Can we invest in pillar 7, which is public administration? You had the president say coffee thieves. You wake up and all your coffee has been harvested. It's not that you didn't do anything, but pillar 7, which is police, LOCs, is not working. Now, the other day I'm told the cows are back. Remember, the last time I had people in uniform stealing cows from a government farm was the NRA in Masindi in 1983-84. They came to Masindi and stole the cows. We knew what they needed to eat some food. But when this happens in the 21st century in eastern Uganda, uniformed men taking away government cows, then you wonder, are we back? Who were these? Well, I'm told the cows came back in the night, but they have had to slaughter some of them, because they could no longer do the purpose that they were intended to do. So that is pillar 7. How do you secure your title, your entitlement, your passage on the road? If these things are not working, the development is going to be problematic. And I think that's where, for me, how do we structure an economy that works for everybody? Not just economics, that works. Thank you.
Thank you very much, Fred. So we've been joined by Honorable Flavia Kabayenda, who is the woman member of parliament for Chegegwa district and the current chairperson of the Committee on Gender, Labour and Social Development in the 11th Parliament. Welcome, Honorable. So I'm just going to introduce you, and then I'll give you a few minutes to catch your breath while we go on with the rest of the panel, then I'll come back to you. So she's famously referred to as Mama Social Protection. She's the founding vice chairperson of the Uganda Parliamentary Forum on Social Protection in the 9th Parliament. And despite not being a sitting legislator in the 10th Parliament, she was very instrumental in shaping the forum's advocacy agenda as the advocacy advisor, spearheading efforts towards the national rollout of the Senior Citizens Grant, which we've been speaking about quite elaborately in the last 2 presentations. She's been the unwavering voice for social protection within and outside Parliament on local and international forums. So once again, welcome. I'm going to move on to Moses. Let's give the men an opportunity to all speak, and then we shall move it to this side. So Moses, you're going to speak to us about the legal and policy strengths, the gaps and the challenges in social protection in Uganda.
Thank you. Good morning once again, ladies and gentlemen. So just to add on to what Paul and Fred have said, and I know they have covered the aspects on policy, so I will not delve into them. I think the purpose of why I earned a seat on this table is perhaps to speak about the legal side of things, or the legislative aspects, which is the outcomes of policy in essence. And I would like to frame it as legislatively, these are the tools, the laws are the tools, the toolbox for which we can respond to the social protection challenges that we have. And I think the challenge we have is, before we can determine that we have an effective toolbox, I look at the laws as a toolbox to respond to social protection. But what are we responding to? What is the problem? So you want to look at the problem, which is social exclusion. And social exclusion speaks to those who are the vulnerable. So the first challenge that I see is that perhaps we fail to frame or determine who the vulnerable are in an effective manner. I mean, from just a wide, just from a wide and generic standpoint, we will name them as the most vulnerable. Those are the children, women, youth, elderly, and the sick. You know, that's the coverage that social protection responds to. So obviously, the toolbox that we bring to the table has laws, which start with the Constitution. The Constitution has a premise. The national objectives actually articulate the intention of government to cater for its people and to make sure they can work, they can feed, they can go to school. Essentially legislating the socio-economic right, which is actually part of the Bill of Rights, and there is an international treaty on that. So that's foundational. But it's something, being in the Constitution is really, that's just foundational, you know. The ultimate tools that have been generated through the laws that come out of the Constitution. And now, just starting with the most vulnerable, I would say maybe, you know, statistically we know that it's children are the most vulnerable, and almost half of our population are under the age of 18. So, we have a law, Children's Act. I think some people forget that that's actually part of the toolbox. But the Children's Act, which was passed quite a number of years ago, has you know, some frameworks in there to, you know, respond to, you know, or to protect children. I think it's anchored on the welfare principle, the best interests of children. Whatever we do as a government, as people, as parents, we must do it in the best interest of children. So that's key. But now, just looking at the demographic, children start from 0 to 18. And, you know, in between there, that's half of our population, you know. And we know that we have a problem of teenage pregnancy. Most of our mothers actually are children. And the assumption we have is that, again, from a social protection standpoint, we respond to motherhood with the right to maternity leave, which sits in the Employment Act. Yeah. So we assume that when someone gets to motherhood, the social protection tool that's there is maternity leave, paid maternity leave. It sits in the Employment Act. But assuming that mother, who often would be a child, also 16, she's supposed to be in school, but instead she's being a mother. And the question is she accessing the maternity leave right? And perhaps not, because either she should be in school or she has not yet accessed the labor market. Now that's the challenge, is that we have children, mothers giving birth. Most of our children are being given birth to by children. Now that's quite a challenge from a social protection standpoint, because we have all these tools which are supposed to respond, but we forget how, you know, the problem plays out in real terms, you know. So again, you know, one will say the other responses are, you know, UPE or USE, that, you know, these people must stay in school up to 18. But more often than not, there are so many gaps in the system that you find that they will be out of school and they will become children, or if they are youth, they will still not be able to access the labor market. So essentially, a lot of the laws that are on our law books assume that you have a job. I mean, we'll talk about the Employment Act, which provides, you know, some social security safety net. Actually, to speak to the social security safety net, really only responds to those in the formal sector. Yeah. If you talk about the pension, which is for the elderly, that's for those who, you know, are working in government. If you talk about National Social Security Fund Act, you know, that's for the formal sector, and it only covers about 3 million. Could be less, actually. 3 million is when you add the other occupational schemes. That coverage is so small for the wider population. So here I'm talking about the gaps, that even if it's a good thing we have NSSF, and actually it represents 25 trillion of our, capital mobilization there is effective. 25 trillion, that's huge. It's a percentage of our GDP. But it only caters for a very small, in fact, even that 25 trillion is perhaps money for only about 500,000 people. I could be wrong, but I'm sure it's not a million. It's less than. It could even be worse, 500,000. And more than, I think, most of the people who have money in NSF have less than 10 million. Very few have over 50 million. So again, you see coverage. The right is there, but the coverage is so small. You know, it's so small. It leaves most of what, in fact, I've heard people talk about the bikini approach, that, you know, the bikini, excuse my Greek here, yeah, covers only the basic parts, you know, and, you know, the rest is exposed. But here, I'm not sure if the key parts are even covered. It's the other way around, actually. We're covering the wrong parts, you know. So, essentially, the tools in the toolbox are responding to a different problem. You know, workers' compensation must assume that you have a job and that your employer has paid for insurance. But look here, even government, which is a significant employer, does not provide for workers' compensation, does not take out insurance. Yeah.
Moses, I don't want you to leave that sector that you were speaking about that's not covered by the bikini. And Paul, you put it at 78%, the informal sector that's not covered. What are the legal barriers there to them being covered?
Actually, the barriers are not legal, and that's the problem. Or perhaps if we frame it that way, the barriers are not legal. The barriers are structural, or, you know, how our economy is organized. We have to know that our economy is an informal economy. It's subsistence and informal. But these instruments are all assuming that we're in the formal. You know, so we have legislated for the formal sector, but the economy is, you know, people in the agriculture, subsistence agriculture, you know, and informal sector, and they are completely outside the social security safety net.
So if the barriers are not legal and they are structural, what would you, as a legal mind, recommend?
Well, of course, that would have to adjust policy, because you see, you cannot respond legislatively without adjusting policy. So the policy has to be designed on the premise that social protection has to respond to our society as it's structured. You can't assume that our society is structured like the UK, where most people are in the formal sector, and then you legislate, you know, national minimum wage, workers' compensation, pension. All those things are very nice, but if you can put your people into the formal, sector. But when most of them are in the informal, 78%, then your structuring has to respond to the informal, or at least begin to work with the institutions which interact with those informal. And those are the cultural, the community churches, you know, cultural institutions and all those. Those ones are already in touch with those entities. But, you know, for them to access, social exclusion is real, but we have to diagnose how our people are socially excluded before we can structure the social protection response. So for now, I would say perhaps the tools we have don't respond to the problem. You know, we have tools for a bicycle when the bicycle is not yet there. People are still walking. So.
Thank you, Moses. Grace, coming to you now to speak to us about the private sector approach to social protection in Uganda, focusing on, very quickly, the gaps, and then your heavy focus on the strengths and any solutions that you see to those gaps. Sorry, the gaps and then? Gaps, strengths, and then give us solutions to those gaps.
So thank you very much. Good morning, everyone. Thank you very much, ICRW, for having us here today. So with regards to the private sector, and I've been asked to focus on the gaps, I just wanted to first give a bit of context. So when we talk about the vulnerable, I think let's just put the numbers. We have a population of 46 million people, 51% is women. So that's about 23 million women. We've got 22% of that population as the youth. That is 10 million youth. So 23 million women, 10 million youth. And then UBOS gives us those who are not in employment, or in education, or being trained. There's a number there, 25 million. 56%, yes, that's correct. 56% are not in education, employment, or being trained. These are alarming figures. Annually, 1.1 million Ugandans join the employment sector. We know that Dr. here and his colleagues are skilling our youth. Every year, about 400,000 Ugandans graduate. We celebrate, we throw parties. But the market can only absorb 100,000. I think it's a glaring situation. And then we have 1.5 million refugees. Goma is Gomaing. And I think the borders, the porous borders, we have the longest border with Congo. So I'm sure that 1.5 million has already gone up. We know the situation in Sudan, and we are blessed, even because we are very warm and welcoming. The likes of Muyenga, Kansanga have become Habesha land. So we are opening up to everyone, from the Horn to the east, to the north, to the south, wherever. And that's okay. But like Paul was saying, do we have enough to cater for all these people that are vulnerable? The private sector is trying to play its part. According to Ministry of Finance, we have 1.1 million enterprises, and the private sector actually employs 2.5 million people. Yeah? We contribute 80% of the GDP. Some of the best examples, and I'm privileged to have worked in Kenya. I remember Kenyans used to envy us of NSSF. They're like, you guys are lucky. Their social security fund is not as vibrant, because even our social security fund invests in Kenya. It's that big or incredible. But yeah, we have the pension body, and we have an act that mandates all employers to make sure that they invest, and that is contribution by both our employees and the companies. However, the issue of informality is alarming, because even though it's mandatory, and I'm sure everyone in this room is a member of NSSF and is privileged, there are those who are in the formal sector who are not privileged to get that. Some companies have gone ahead and provided provident funds, medical, healthcare, maternity leave, paternity leave these days, and paid, which is great, paid leave, mental wellness initiatives. I think we're starting to see innovation from the private sector to take care of the vulnerable and the employees. And we're also seeing a huge ESG agenda, that is the environment, social and governance approach, which is encouraging or stretching private sector players to invest or put money in communities and help with the intervention around health, education areas. So I think for me the gaps are in the formal area. And I just want to talk about the formalization, because everyone has talked about it. It's a passion point for me. Sometimes it looks like it's complicated, formalizing, getting companies to register. Those informal businesses don't want to know about URA, they don't want to know about URSB. They are hardly making profit, and you're telling them to pay tax. We are one of the most entrepreneurial countries in Africa, second to Ghana. 38% of Ugandans are entrepreneurs. So if you count 1, 2, 3, 4, the fourth one has a hustle in this room. You count 1, 2, 3, 4, the fourth one has a hustle. We are entrepreneurs. That's brilliant. But only 10% of those businesses live to see their 10th birthday. Most of them die along the way. Only 10%, and over 50% don't even see their 5th birthday. which is a big challenge. Now, when we talk about formalizing, some of those guys don't even know whether they're going to be there next year or not. Or maybe they'll run this year and it will die and they start another one next year. That's real. When you're talking about social protection, then it becomes very difficult to offer medical, pension when you don't even know if you'll be in existence in 2 to 3 years. But I want to give a good example, and everyone talked about formalization or informalization. I remember watching closely Jennifer Musisi's initiatives, building markets in Kampala. It got her into trouble because she sent away some hawkers. But you see what that did, building those markets. Now every market vendor in that market has a stall, has a number, pays KCCA. So you can track them. You can register them. You can follow up. The issue with informal is usually we don't know. They are not anywhere on the radar. You don't know where that street vendor is. You don't know where that vegetable vendor is tomorrow. But when you build structures in place, you're able to. And I noticed also that Indians are very clever. They come early, they lend out money to those vendors. They'll lend 200K to that market vendor. You go do your business. At the end of the day, you pay me back with 10%. In the evening, they come back, they collect the money. So you see, you're formalizing the informal in a very unstructured way. But if we start capturing the data, we can actually start tracking, and then maybe government can put in place interventions to address that gap. So there's opportunity for us to actually formalize the informal sector through such initiatives. Instead of letting people just occupy a street in the evening, build a structure. Let them come. Let them allocate them a stall. Even give it to them on credit and tell them pay for it in 5 years. So that eventually they own it, but also you have them in the system, they are paying, and they pay a lot of things. If you build, you've even contributed towards the economic transformation. So anyway, there's that. The other one is most employees in Uganda do not have contracts, which just at the onset makes them vulnerable. And first, you have informal businesses, they're not going to give you a contract. Even the formal do not even issue contracts to employees. So there's no commitment from an employer to say, I'll take care of you, I'll look after you. And that also means that they can wake up and fire as and when they please. And you walk away without benefits, without compensation, which is, I think for me, something that policy can actually help us with, that we make it mandatory like we did, that employers must provide, must contribute towards pension. Then also they should have contracts in place. We have resistance, like I mentioned, to some of the social initiatives from businesses. They don't want to pay NSSF. They don't want to pay medical insurance. But also that's because maybe they are not healthy from a financial perspective. But also, we are very great sometimes when it comes to writing policies as a country, but we are not great at implementation. So really driving it and enforcing it, there's opportunity to actually enforce it. Then we've got inconsistent business performance and longevity of businesses, which I talked about. I think for me then the other one would be the fact that it's expensive for businesses to actually invest in people. So social protection comes at a cost. If you're going to pay pension, provide provident funds, because some companies actually do more than just NSSF. They also go ahead and establish provident funds. That's at a cost. And some of them might struggle to give that, even though they're willing to provide it. So those are the challenges. But if you could allow me, I would like to talk about the interventions a little bit more. Okay. There's opportunity to innovate in that social space. Why do I say this? If you look at a boda guy, for example, he earns maybe 20 to 40K a day, 20 to 40,000 shillings a day. If you told that boda guy to put aside 2,000 shillings per day towards education of his children or towards medical insurance of his child, that 2,000 times 30 days times the 12 months in a year is actually 720,000 shillings. That is the money you pay Prudential for medical insurance. It's not impossible. And he's probably paying it at home for GoTV, for cartoons for his children every day. But he doesn't, no one has gone that extra mile to create awareness and educate people and tell them, you can actually afford it. If you put 2,000 shillings aside a day, you can do that. But also, this is where government, like Paul was saying, is responsible. Maybe government could say, I'll meet you halfway there. I'm going to put down 50% for you, raise the other 50%. And this is an opportunity for collaboration between insurance companies, between government, between civil society organizations, between private sector players, to come to the table and say, let's find these interventions. Find philanthropists who are willing to also invest, either in medical or education. We can do this, but we need, like they say, you can't just eat an elephant overnight. It's bit by bit. If we sit down, we can actually come up with these innovative ideas. We haven't innovated in that space. Each time I meet insurance people, I keep telling them, guys, you're leaving money on the table. Even bankers, same, banking, access to finance, there's opportunity there. But you said I didn't have much time, so thank you very much.
So we're going to come back for closing remarks for a round from all of the panelists, and you can get into that a bit more, but I really like the idea that you're speaking to on how we can innovate. Mercy, she spoke about civil society, and so I'll come to you. And even as you speak to us about civil society advocacy efforts to promote social protection in Uganda, I'm curious to know what you think about what she just said about how all of you can come together without waiting for government to yam.
Yeah, I think picking up from that point, I like to look at civil society as the bridge between the state and the citizens. And I believe that there is a lot of opportunity, especially from the private sector, that we can leverage on to expand social protection interventions. I'll give an example. If you look at some of the community interventions from especially the private sector, many times they are not guided by actual need. They are guided or driven sometimes by, their corporate interests and guidelines and what they intend to achieve from their perspective, while civil society has access to data and has tools that could otherwise guide private sector investments in communities so that they go to address actual needs. So we have a lot of research that has been led by civil society. We have a lot of structures at community level that may not be adequately funded, but they're social protection interventions. And I believe that is where if we leverage on that partnership, as she said, then we'll be able to complement one another and the community stands to benefit the most. And speaking of civil society, so last year, I did some work with NGO Forum, basically to assess civil society's contribution to development. And at that time, from the data available with the NGO Bureau then, before the merger, there were about 3,267 registered organizations according to their records. But we know, of course, there's a lot more probably that is not captured by that data, and this could have changed upwards or downwards. And looking at what they do, of course, there's a broad spectrum of interventions by civil society, but I just thought there are specific aspects that relate to social protection that will be important for me to mention. So, for example, of that number, 3,200, we had about 1,557 that was specifically doing work around social services and development. And that represents about 68% of the organizations that were registered. And the second highest number was working around issues of health. That means there are programs and interventions focused around health. And then education came third. And then justice, law and order or legal related interventions. And then agriculture, water, accountability in that order. And I want to just paint a real picture in terms of the role of civil society in social protection. So in terms of direct service provision, which is a very critical role that civil society organizations play, you realize that many civil society organizations spread across this country are doing direct service provision. If you look at the different aspects of social protection, you'll find different civil society organizations doing direct service provision. So one of the interventions that I like to talk about is, for example, the gender-based violence interventions. And I just want to pick one aspect of that, which is the gender-based violence shelters. When my colleagues were speaking, they painted a picture of our general population, which is almost 46 million people. And if you look at the number of districts now, I think we have about 146. But can I tell you that we have only 18 gender-based violence shelters in this country, across the regions. And if you look at this, just vis-a-vis the number of districts, that means there's only 12% of these districts that have gender-based violence shelters as a key intervention. And all of these are run, of course, collaboratively with the ministry, but heavily dependent on donor funding and run by civil society directly. And so if you're looking at 45 plus million people in Uganda being served by only 18 gender-based violence shelters, and yet you have statistics that show that gender-based violence is on the rise. What does that mean in terms of actual service provision? And with the sector under threat constantly, for example, from funding, the shrinking civic space, this is a service that is so vulnerable that it can easily shut down overnight. Recently, when the USAID funding cut happened, ActionAid, where I work, we run majority of these shelters, and there are other organizations that run the rest. At least 2 of them were affected by these funding cuts, and these 2 are actually the ones that serve the highest population. One here in Boise, one in Mubende, that specifically have interventions that also target, HIV response, sexual and reproductive health and rights. So when this particular order was passed down from the US and we got the notification here, the shelters had to shut down. And regardless of the reasons behind that particular executive order, there is a woman that needed protection that night. There were women actually at the shelters that night that was there with children and young people who have come for protection. And now you're in a place where you have to shut that down. And if you look at the state of social protection and the statistics in that report that some of us in this room have, and you look at the interventions from the ministry in 2021, in this particular intervention, it was 0.01%. That's the irony. And if I'm not mistaken, the Ministry of Gender probably is one of the most underfunded ministries. But that is where social protection sits. So if a foreign entity decides to suspend funds or aid today, we don't have a fallback position because that is not a sustainable intervention. And that's the reality of the work civil society does, which is heavily dependent on donor funding, vis-a-vis sustainable interventions around key aspects of social protection. And I just thought to highlight that. But also civil society is very core around issues of monitoring, evaluation, and learning, specifically evaluating and monitoring social protection schemes. Why is civil society very critical in this area? Many civil society organizations have access to the latest tools, monitoring, evaluation, and learning tools. One of the key gaps you see in terms of social protection programs is the fact that many times work around this sector is not informed by actual data. It's not measured properly the way it should, because when we talk about vulnerability, you'll see new monitoring, evaluation, accountability and learning approaches like the feminist monitoring approaches that are very important to see that whereas we have programs that are by either civil society, private sector or government, we must specifically target what are some of the feminist dimensions of these interventions, what groups are benefiting. When we're looking at the gaps and presenting all this data, it must be also considerate of the gendered aspects of social protection. Otherwise, we miss the point, and that is where civil society becomes critical, because they have access to these tools, they have capacity, and that is something that can benefit social protection very positively. But also one of the critical roles that civil society has played in this country is, accountability. All the different accountability mechanisms that you see running in this country are led by civil society because of their position, which according to the law, but also in terms of the work they set out to do, is to ensure that they drive accountability, that conversations like we had last year around NSSF and where the funds are going, different conversations around budget tracking, monitoring, and accountability for public services is led by civil society. And I believe that is very important because in this country, if you do not drive accountability for even the resources that we're talking about here, a lot of the public resources get lost in corruption and the different vices that we see that compromise the quality of services that the community receives. But related to that is also the strength in research, and I'm glad that we're here with ICRW that really focuses on also research that provides the most critical data that is needed to drive advocacy for policy and also give us the status of social protection in the country. Without that data, we cannot demand for policy. We cannot demand for, the things that we want to change in this country. So civil society has played a very critical role, even during the advocacy for the different pieces of legislation we talked about earlier. You'll find that both in terms of resources, capacity, data, civil society has been very central. And I think that is a very important bridge, because the conversation around social protection cannot be built on one sector. It has to have government, private sector, civil society, identifying how to leverage on one another's strength.
Thank you, Mercy. And I think one of the key things that we're going to do towards the end of this conversation is all together to think through actionable recommendations. Mm-hmm. So I'm going to move on to Honorable Flavia Kabahenda to speak to us briefly about community experiences and legislative opportunities to strengthen social protection in Uganda.
Thank you very, very much. I would like to greet you all. Good morning and Happy New Year. And I thank you very much for this opportunity for us to continue the conversation on social protection. But I think I will not delve so much into what my colleagues have discussed, but for us to all really put ourselves into the shoes that when we talk about social protection, we are not talking about poverty. We are talking about vulnerability. Some of us in the room here may never be poor, but we are all vulnerable. That's for a fact. None of us has even the capacity to protect yourself against vulnerability. You can amass all the wealth you want and never be poor, but you are vulnerable still, because you won't protect yourself from an accident, from any futuristic happenings. And therefore, when we talk about social protection, we are looking at preparing people for a constructive role, building their resilience to address inclusion and making sure we don't leave anyone behind. So after all of us putting ourselves into the vulnerability chair, we need to know that nobody actually can get away from vulnerability unless we were prepared to take care of it at the time it comes. No one pushes you into vulnerability most times. Situations push you there. We have started seeing climate actions. We have started seeing the very many accidents on border, the very many road accidents, everything. So we need to look at things now very clearly. That's why I'm looking at this thing on a community, with a community lens. Because when we sit in these chairs, we may not even understand what it exactly means. Just look at the recent COVID-19. Some of us, the people we thought were actually rich, ended up not even showing any kind of richness, because you had to park the car, you had to walk, you were even stopped from walking, but the person on a bicycle was not stopped. The person in his banana plantation was not stopped. For you, you lost a job, you lost money, you lost employment, you lost wealth, you lost even being in your intercooler, and this poor man continued to feed you because you had not even invested anywhere. So that requires us to research, and I would like to applaud ICRW for the research component. We need to redefine vulnerability against poverty. We need to rewire our systems to make sure that the interventions and policies are not only meant to be aspiring for ready-made policy solutions or resolutions. We need to have our policies and interventions to identify trends. We are in a new economy. How is social protection going to play in the new economy, where technology, globalization, competition, deregulation are now the new trends in the new economy? So where does social protection find itself? And all these new things in the economy are pushing people further into vulnerability if we are not careful. So we need to prepare people to stand for the situations as they come. And we want to assure you that social protection actually is not a favor. So most of our policies and strategies seem to be getting us out of poverty, and they seem to be working as if they are giving us a favor. This is a right. Social protection is a right-based approach. It's a human right. It is humanitarian, and it requires that human rights approach from birth to death. If we cannot even register a child who is born, what social protection are we talking about? Who are we planning for? Who is the policy for? So, members, colleagues, the statistical realities and the social protection aspect are very alarming, the way my friend Grace was bringing them out, and my colleague from civil society. If the UN of 2017 status report states that between 2017 and 2050, the number of older persons in the developing world will be predicted to increase from 65.2 million to 2.1 billion. And by the time we have NDP 5, Dr. Muhumuza, we shall be planning for an aging population. Because the fertility rates are being gagged every day. The women have learned to give birth when it is necessary. So the best you can get from her is 3 children, and you must be appreciative. Otherwise, it is 2 children, she goes back to school, she wants to work, she wants to make wealth, and so the young people coming are going to be fewer than the aging population. I don't see NDP 4 beginning to even come up with strategies on how they are going to handle the aging population in terms of social services and inclusion services. And we know that by 2047, we shall have that kind of trend where the children may no longer be the majority, but the older persons will be majority. UK is beginning to experience this. And in their campaigns now, whoever in their manifesto does not address the aging population in UK, you may hardly get a vote. Currently, UBOS is telling us in the recent census results that 5% of the 45,935,000 Ugandans are older persons. Does that take us to around 9 million of older persons? If we trust the results anyway. 5% of the population are older persons. And 10 years ago, older persons were being counted at around 2 million. Today, if we are taking them to 9 million, then you can see what I'm saying, where we are going to. And that is the dependence. Because when you put older persons, you add people living with disabilities, you add children and the young people, then almost 79% of the country are dependents. And I'm sure each one of us is feeling that, even in our homes. You are the person who only has an occupation and not a job, because they see you bathing every morning, smearing, and going out, and they think you have a job. Kumbe, you are just going for some occupation. And now all the eyes are on you, waiting for how you will come back and what you are about to deliver when you come back. So the dependence ratio is biting on all of us and almost the whole country. And this requires us to be realistic as we talk about social protection. Not much more about the policy, but the actual interventions to make sure we build resilience and we don't have to carry people on our back that we are trying to give them any reliefs. So we need social protection that is going to make interventions into disasters and things that come up without our notice and without our preparedness. So we need that kind of fabric, shock responsive social protection. The Kitezi must have told us a lot of stories. The recent Kitezi required us to have shock responsive social protection policies, and not a simple national social protection policy that will tell you what and what. No, we have shocks now in Ududa, in Kasese, wherever there are disasters of climate-related issues. We need shock responsiveness. How much are we preparing these communities to take care of it even before the government can go to get them out of the rubles when they have been covered by the floods and grounds? 12.4% of Ugandans have some form of disability. We are looking at 6 million people in Uganda who have some kind of disability. And the households with the disability spend 39% more than the households without someone disabled. That is from the Disability Difficulty Survey of 2017. And we know that access to decent work for all Ugandans is a problem, critical. But access to decent work for people living with disabilities is at 1.3%. And that is UBOS that told us in 2017. I don't know what it is now. That is why even when we were discussing the NSSF law, the people with disabilities were telling us, for us to wait for 45 years so that we can access midterm becomes very difficult, because a person with a disability losing a job, even at 30 years, it will be difficult for them to have another job because of the discriminations. And my district is a host to refugees since the 1960s. 1.6 million refugees, but 8% are people living with disabilities, and 75% of those report limited access to humanitarian response. What can we do in terms of both policy and interventions? Someone talked about skilling. The whole country is now skilling. Short-term skilling, long-term skilling, everything. Universities are opening up every day. But when will the educationists talk to the employers? Because the skills we are putting are not appropriate to the labor market. The labor market is still telling us they need employees, they need skilled people, but are we sure the skills we are giving are the ones that are required for the labor market? And so we need to start having discussions between educationists and employers, for the employers to specifically put down the skills they need for the employment they offer, so that the universities don't simply put courses to make students become donors of universities, but rather people who are going to go out with skills. What are the interventions that need us as legislations, opportunities I'm seeing? Dr. Muhumuza, you are behind the PDM fabric, but can we distinguish the loan-based livelihood programs Loan-based livelihood programs are not a social protection tool at all. They are not. We need to calm down and understand whether the people we call vulnerable will access PDM. Up to now, the 39% people living in abject poverty are not accessing PDM because of so many things that disadvantage them from actually accessing and getting the loan-based livelihood programs that the government is presenting. So the core social protection programs need to address vulnerabilities. The very simple thing, families living in abject poverty, we know some of them are child-headed households. Now how are you going to give a child PDM? But this child is heading a household. The household you are counting among the 39%. Which program in Uganda gives economic empowerment to child-headed homes, to children heading homes? They are not at school, they cannot be employed, they are underage, they cannot even be given any economic support because they are underage, and so those are left behind. They need a social protection intervention for them. And of course, the funding on social protection has remained below 1% of the GDP, even when the returns on the investment are clear that every coin you put on people will return much more. But the funding on social protection remains very, very low. Maybe we need to sensitize the planners. We may look at NPA and we expect that all of those people can plan. Kumbe, they could be just occupying space. So I think we need to start there and sensitize the planners of this country to even give them the realities as they are, so that they don't go so much into technicalities, but the reality. And their figures should reflect what actually is on the ground. We continue. Today, we are still using the African style of looking after our older persons. But in no time, we shall have to establish homes, care homes for older persons, because we have to work, we have to look for money, we have to create wealth. And so the older persons with time are going to be in these homes for care. So how much are we investing in care work? What is Uganda giving to care work? How much are we training eligible caregivers so that the older persons and their people are not fleeced by people who just pick papers from the streets and then present themselves as caregivers, and by the time we realize they are torturing the older persons. The child disability grant has remained unfunded, an unfunded priority, and today, given that very many children are vulnerable, we need a child-sensitive social protection tool that will address matters of the vulnerabilities in children. And we have the Girls Empowerment Program in the Kampala Greater Metropolitan as a child-sensitive social protection, and also NutriCash that is in West Nile, but of course almost all of them are supported by civil society. Can we scale them up so that the Girls Empowering Girls program can spread out, and also the NutriCash for mothers that are lactating and are pregnant can also take on to the other districts which are equally vulnerable. Let us enhance the planned data collection for social registry as part of the single registry for transformative and impactful targeting. I want to thank the Ministry of Gender for moving from policy, and now they have a national social protection strategy. So let's go on. We now need a law. For us as the Uganda Parliamentary Forum on Social Protection, that is so little done and so much to do. We now need a law that will actually sanction and also deal with those who will not comply in as far as social protection is concerned. Let us research on shock responsive social protection interventions, and we have enough lessons from Kitezi, from COVID, from climate actions and other disasters. Let us do strategic shifts in engaging partners to support rollouts and upcoming social protection programs. Also, strategic resource mobilization approaches. Maybe we may have to come up with a certificate of compliance for every sector on social protection the way we have a certificate of compliance on gender and equity, so that each sector has a social protection outfit and their planning and their development programs have interventions on social protection. And also let us mainstream complementary social protection in a deliberate manner through a means test. Like under all NDP4 program areas, let us mitigate the burden on the core social protection schemes. In the event that the Ministry of Gender is perennially underfunded, can we now start making sure that the programs we have in the NDP4 have a social protection means test? And maybe final and not the least, traditional and community-based social protection be harnessed. Can we institutionalize social workers so that we harness the traditional social protection interventions that people are already giving without the notice of government? People are looking after older persons, people are looking after PWDs, people are looking after children, disabled children, and they are carrying the burden of taking a disabled child into school. It is damn expensive for you to have a disabled child in any school here in Uganda. It's a burden. And so we can harness the traditional aspects on social protection that the communities are dealing with, and make sure institutionalize social workers to keep looking around and overseeing these traditional interventions. Maybe I can stop there for now.
Thank you, Honorable. I see now why you're called Mama Social Protection. You have even given us the recommendations that we're going to come back to the panel for. So I will take one or two questions or comments from the room, if at all. Anybody? And if there is no comment or question from the room, then I will come back to the panel. And since Honorable has already given her recommendations, Paul, I will come to you to quickly give us at least two recommendations on how we move forward, and then we'll go this way before we close.
Okay. Thank you very much again, and thank you, Honorable, for those remarks. Just to say that when the world launched the SDGs, the issue was leaving no one behind. But from the conversation that we've just had, it's very clear, even with the data, that a lot of the vulnerable have been left behind. We have a benchmark. The sub-Saharan average for at least one person to be covered by one social protection is 17%. But our current coverage for the country is 6%. So that means that as a nation, even comparatively with our peers, we're already way behind. Now the NDP4 target is to move this at least to 10%. We didn't achieve it in NDP3, and we carried it into NDP4 to attain at least a minimum of 10% of our vulnerable population covered by at least one. The issue is one. It's not all, but at least one, because we can't get to the Nordic levels or the countries, the Nordic communities, where the coverage is extremely very high. Then how are we going to attain that? And I'm very glad, again, Honorable has talked about the law. Very good, because we need to hold our country accountable for the commitments that we make. And Council did well. He talked about our constitution. So how do we then continue to hold our country accountable for these commitments and for the intention and also the responsibility to care and look after the poor Ugandans? And I like the civil society, the role of the civil society. That's very, very straightforward. Advocacy and holding accountability. Then the second part is, also as a ministry, the next question we've asked the government is, can we finance social protection even with the state of our economy? And the answer for us is yes. Poorer countries, even much, much poorer countries like Lesotho and others, have a higher social protection coverage. So the issue is not the economics. The issue is the political will. The political will to look after your poor and vulnerable. And when that will is there, the economics adds up. And we have even gone ahead further to try and demonstrate how we can leverage, once we have the political will, how we can leverage on the economics to ensure that we finance social protection. And last year, with the investment case that we did produce, we did a physical space analysis for how we can finance social protection. And there are primarily two ways. One is the tax-financed, which is now government. And even in government, we even go further and make some recommendations. How can government leverage itself to finance social protection? And I will just indicate this. I will just be briefly sharing this with Prof. One, we have the opportunity of our oil that is coming up. Can we agree as a nation to invest a small portion of this for purposes of attaining social protection? A lot of evidence is everywhere. All these countries have done this. In Norway, in Alaska, in Botswana, all these have really demonstrated that you can use your natural resources in a sustainable way to invest in social protection. The second is, we have identified, even when we are running SAGE, even when introducing the social assistance grants for empowerment, we said, can we have a redistributive tax approach where, at least for purposes of redistribution to the poor and vulnerable, and as we say, this is not a favor, it's a right, can we have what you call some taxes or levies, a portion of which can go to financing social protection. And from our model or simulation, we are proposing an increase in the gambling tax, for example. We can raise money that we can use to finance social protection. We are proposing an introduction of an electronic transfer tax on fees charged on RTGS and EFTs. I know this affects a lot of us in the room, but we're trying to look at areas where at least we can leverage sources without, again, worsening the status of the poor. We are talking of a tax, an excise tax, just a 1% increase, excise tax on confectionery, and just a 1% increase on a tourism development levy. Now, when we do this, and these are carefully thought through, Prof is an authority in this, these are carefully thought through so that we do not worsen the state of the poor and vulnerable, but be able to generate resources that we can then plow and invest in social protection. And with this, we'll be able to raise close to about 56 trillion by 2035, and we shall be investing in social protection. But then the last one is social protection is not only tax financed, and I like the private sector. We have to leverage on the contributions. We have to leverage on supporting Ugandans to contribute for their social security by expanding opportunities to cover the informal sector, by enabling them to have the self-belief that first of all is, yes, the state can look after you, but also if you can, also make a contribution. We've just completed the national strategy for extending social security to the informal sector, and we're working out to start with just what you call umbrella associations. We're looking at tea, sugarcane, coffee, and maize. These are a little bit fairly organized, and we're trying to see how do we use those organized institutions, working with UBRA and the institutions, the academic research institutions, who want to engage like MOOBS, EPRC, and others, to see how do we support such persons in those sectors to be able to contribute and therefore try to reduce the burden on the state, but maintaining the principle of providing social protection and social security for all. Thank you.
Thank you, Paul. Mercy, I'm going to come to you next. I'm going to ask that we are a bit brief because we have already gone past the time we promised we'd be here.
Sure, thank you. I think I'll sum up my recommendations, borrowing from ICRW about the gender smart investments in social protection, which really aligns to what I said earlier about leveraging on some of the capacity strengths of civil society to advance the recommendations we're laying on the table. Part of learning, the learning in monitoring, evaluation, and accountability and learning is about looking at current contextual challenges and using the learnings to invest smartly. If we have now been hit by donor-related cuts like what is happening with USAID, what happened with DGF a few years ago, what are we learning? How are we being more sustainable in the way we budget, and how are we being deliberate and investing into the initiatives that are highlighted in our policy? I think for me that is very important. The second will be the building the bridge between private sector and civil society as a sustainable approach to social protection, because I know that there are opportunities for us to direct investments from private sector to address key gaps in social protection. I know that because they serve the biggest number of our population, and civil society on the other hand and government have different pieces of data, research, and policies that need investment. Leveraging on that strength would go a long way in strengthening our social protection interventions. Thank you.
Thank you very much, Mercy. Grace?
Okay, thank you very much. I think my key point to make is innovate. Innovation from the social perspective, from government, from private sector, will go a long way in helping us address some of the gaps. A great example is the telecoms industry. If you look at the telecoms, they have really transformed financial inclusion. Right now we have 34 million people who have access to the mobile phone. That means you can send money to your grandmother, that woman growing barley in Soroti and supplying an aggregator can get her money to her mobile phone. So that has actually transformed the way we operate. And that is a private sector entity that's transformed financial inclusion. There's opportunity for those in the medical space, in the insurance space, to also play a big role, in the education space, to play a big role in innovating and making sure we have interventions that protect the vulnerable. An example is, for example, why is insurance only at 780K for a family of husband, wife, and 3? Why can't we have a value pack? If I'm a youth and I'm single, can I have something at 340,000 that covers me? And I'm a border guy. So if I have an accident, I go to Mlago, I get treatment, I don't have to pay. I walk out. Do I have to wait to get a family and 3 children to access medical insurance, for example? So for me, it's innovation. We can find solutions. Then there's the opportunity around regulatory framework. And I think this has been mentioned, but formalizing the informal, giving startup businesses, for example, tax breaks to allow them to first, catch on before the taxes come in, because they can be crippling at the onset. And we know that when we employ people or when we facilitate businesses, they thrive, they create jobs for others, they employ more. The other one is financial inclusion. PSFU is lucky to be rolling out one, to be collaborating with the World Bank and government. And I think Deborah had actually asked me to talk about GROW, the project that is driving financial inclusion for women, for example. And the fact that the women in businesses are the ones getting money, we know, and I think even the banks have said the women are paying back the loans faithfully. But we know that once that woman has money in her hands, like doctor was saying here, if that woman has money, the child is not going to be sick in the home. She will take the child to hospital. So you've addressed the health care issue. The health issue. If she has resources, you've addressed education. She'll take her child to school. So it's one of those projects that we are excited to be implementing in collaboration with the Ministry of Gender and the World Bank. I think the other thing that it actually does is that it addresses the issues of the rising single mother. We know we have a lot of single parents. When I was growing up, I saw more family units. These days, it's so normal. And it's okay to have so many single women raising their children, but this project actually is skilling them and facilitating them to make sure that they have sustainable businesses and can take care of their families. Maybe the last intervention I'll talk about is government initiatives, and I'm very happy that we have one of the brains behind PDM, but also GROW is one of the government initiatives. Invite, Emioga, youth funds. I've heard of an agricultural fund. All those are catalyzing business growth for us, because all those are entrepreneurs. The people who are benefiting actually entrepreneurs, which is perfect. And that leads to the issue I raised about the youth, creating the jobs. So we create jobs once people have a livelihood, then you address all these social protection issues. I think that's it. Thank you.
Thank you very much. Moses?
Thank you. As a way of recommending solutions, I think social challenges cannot very easily be solved by legislating, but legislation is a good starting place to get to do something. So I think most importantly is diagnosing the problem, and I think a lot of research is required, and I commend ICRW for commissioning a research into the problems and the challenges that, to answer the question as to why is the coverage so limited. Even for the formal sector, we know there are challenges in there, but the bigger problem is having the majority of our population uncovered. So the recommendation in there is that we need to find why, why is it that, we can perhaps speculate for some, but, I think research is a good starting place. But also we could leverage on some opportunities. The informality, as Grace has been talking about, formalizing the informal, we know that the gig economy is now on us, and that's an opportunity for us to leapfrog. So you find that these people who are in the informal sector may never get into the formal sector, but they can be leapfrogged into the gig economy with Uberization of everything. The borders, all these things are being Uberized. I think we all know what Uberization means. So, of course, the challenge there is internet. If penetration, how many people have access to internet or to a mobile phone? I mean, Grace just told us about 34 million? I don't know if they all have smartphones, but our internet penetration, we would need to do more in extending that so that we leverage on, the opportunities for the gig economy, which would consume, at least we would have more youth involved in the gig economy. And many of them are, all these border riders, that's opportunity for Uberizing, But, the other challenge, of course, would be education and skilling, because for them to be included, I mean, there's digital exclusion from financial exclusion. Now the issue is actually digital exclusion. Just consuming government services, you want a passport. It's e-government. You have to be on the internet. You have to go on a government platform. So we need to solve the challenge of digital exclusion. And perhaps also a digital mindset, cultivating a digital mindset, because you may have access, and I know many of us have, but how much can you do if you don't have a digital mindset? So that goes to the education also, and skilling, because even the adults need to cultivate that, So mostly for our youth, so that they can harness the opportunities that are in the gig economy. Now, can that have, a legislative, solution? Perhaps, but more importantly is, having laws, you can legislate as much as you want, but if the resources are not there, you will not do much. In fact, we actually have very good laws, like for the formal sector. The coverage is quite good, but still, the compliance levels are not where they should be. I think, let me end there.
Thank you very much. Fred, I served you for last because you said you're a member of the family. So I wanted you to wrap it up.
Oh, thank you. I think just two things, and they've been mentioned here. One, we need to redefine what social protection is, because we still have a very narrow portion of it. And as Honorable has rightly put, it's about vulnerability. And vulnerability is across everywhere. Whether you are rich or poor, vulnerability is going to be there. So once we broaden that, then we want to say, let's not start with the word social. Let's start with the word protection. Then see what are these things that people are vulnerable to, where they need protection. Maybe there will also convince the president, who is so much concerned, rightly so by the way, to protect us against the military threats, now also to protect us against the non-military threats. Because we have a lot of work that is going on within the security forces, that when there is no war, you get into the other threats other than war. And that's how you find the military in Operation Wealth Creation. These are threats other than war. So now that the office of the president and the commander-in-chief, and you want to leverage this, because these are the people for me to sign my executive orders. But I want to hear that extra conversation so that they look at this the way we are looking at it, and then we'll be on the same page. So we need to do that. He talked about the coffee farmers, they are vulnerable to thieves. The other day he met a farmer who lost 15 cows. Each of these cows was 3 million. This is a rich man, you would imagine. But all of a sudden in 1 week he had lost 45 million. That guy is vulnerable. That guy needs to be protected. And what is the problem? Adulterated acaricides. And it came in the same week when people had stolen acaricides from Mr. Museveni's farm. Now, if you really wanted genuine acaricides, you have to steal from the president's farm. But is that how we should be protecting ourselves? But these are the things we want to take to him, that the vulnerabilities are all over. How do we make this an Ebola case? There was just one Ebola case the other day. It really hit the headlines. Now, if we were to compile how many people are actually dying because of the current state of social protection, we'll be raising the evidence that is required to back up Honorable when she goes to Parliament to say, by the way, this is a serious matter. So I need us to get there. The good news is we are now getting to the stage of reforming the public service. You remember it was not contributory. We've been on that discussion for 2 decades. But now I think there is a cabinet paper going through to legislate and make sure public service is also becoming contributory. Now there are people there who are picking 5-10 million a month. But there is also somebody I noticed who is picking 5,000 shillings because at the time they retired, that's what was available for them up to today, 5,000 shillings. But also the gig economy, there is a lot that we can leverage and start with. MTN tells us their lending on their app has gone up from 400 billion to 1.4 trillion in 1 year. And these people are borrowing between 20,000 and 40,000. Now, those are things to leverage as we design how do we deal with vulnerabilities, where are people. So you may take off grow, but the majority of these women and men are on the not on grow. So how do we find them there and support them? They borrow daily and pay back daily, genuinely paying back. The border you are going to ride in the morning, who gave him that fast fuel? He borrowed on the app. But at the end of the day, he has reconciled his accounts. And these are things for me I would want to bring in the table. And I'm glad we are going to be working together with the ministry. But let's do a real comprehensive work that is targeted to say this protection is similar to what we're doing in the UPDF, so that hopefully the president will sign my executive order to find some money. And I'm not going to leave this until we get the solutions. Thank you.
Thank you very much. Please, let's give a round of applause to our panel. Something that really says they spoke to the issues we came to listen to, not that hungry one. A proper clap, people. Great. Thank you so much, all of you. You may have your seats. I'm going to now invite Evelyn Opondo, who is the director of ICRW Africa, to close this event. Evelyn has over 23 years of expertise in human rights, reproductive and gender justice advocacy, and international development leadership. Evelyn? We can see you.
Thank you so much. I want to just start by appreciating all the speakers. Job well done, really, really well done. I wish we had so much more time to do this, but I think it's a good starting point for us. And I want to just appreciate I was actually going to summarize some of these points, but our board member and everybody has done a really good job of summarizing. So it really, I should not dilute that. But I want to just underscore some of the things that have come across for me. One is the need for us to really contextualize our solutions. We have been challenged. I had Moses, Fred, and everybody say that a lot of times the solutions that we put on the table are things that are borrowed from other places and are not necessarily speaking to our own context. And Fred has ended by saying we need to first of all ask ourselves what is social protection, and maybe even begin with protection rather than social. And I think for us as ICRW, we find all of this very challenging. What we are hoping to do with the recommendations that you have made here is one, first to summarize them into a brief, and then we will use that for further investigation, research that we are doing, which was mentioned, some research that we're already doing around what is a sort of social protection that women want, but also to use this for recommendations, for policy recommendations. Just to summarize a few of the points that I thought also came across quite well. The need to calibrate and reconfigure government systems and shock we heard from the government, and the fact that yes, there is policy, but policy, legislation, all of that is not sufficient if there is no budgetary allocation to enable us implement, if there is no sufficient political will to enable us to invest, to realize that. We also heard about the fact that the informal economy is largely excluded, and the fact that the majority of Ugandans actually who are vulnerable are in the informal sector. And so how do we use our traditional systems? How do we use all that we have in innovative ways to speak to that? I really like what the Member of Parliament also said around social protection not being about just poverty, but also about vulnerability, and the need for us to tweak policies and trends. Look at what is it that is pushing people into vulnerability so that we are consistently responding to address those issues, and the need for research looking at shock-sensitive social protection initiatives. I want to say that as ICRW, we are committed to women economic empowerment, and this is just one of the ways we create these platforms for dialogue, and we try to get different angles into the conversation, which we then use to inform conversations not just in Uganda, but some of the things that we've had here today are also going to inform some of the interventions that we have at the regional level. So we thank you for that. Lastly, I want to just take this opportunity to really thank again the speakers for really making the time, sharing your expertise with us. I want to thank all of you who made it here this morning. This was a really early morning meeting. We appreciate that you are able to make it. I want to thank all the journalists and our communication support that we've got. Athari, thank you so much. Penelope, thank you for embracing us into this space. I want to thank the government. We appreciate the partnership that our office here has had with you. You have been a great support, even in the research that we are doing, and we appreciate that. I want to thank our board members. Fred is still here with us. Jackie has stepped out. Thank you for the leadership and the continuous support that you give us, and our lawyer who makes sure that we are always legally compliant. Thank you. Thank you to my colleagues who did an amazing, amazing job to make this happen successfully within a very short time, and who are going to push the agenda forward beyond this day. I thank you, and I thank all our tech supporters who will ensure that this is online and ensure that it's covered. Thank you so much for the facilitation. Thank you to all of you.
When we meet with the session, to just say hello. Yes, of course. So I'm just going to ask Honorable Sarah Kuti to just come and say hello, and even wave with your voice, or just wave with your hands, so that we see you and we recognize your presence here with us.
Thank you so much. I wanted even to request for 1 minute before she closes, but I think God was also talking to you that you have given me this minute. I send my greetings to everyone who is here. I thank all the presenters for what they have presented to us. Thank you, our honorable member, for representing us. My name is Sarah Guti, Member of Parliament representing Dokolo District. I had one concern when our presenters were talking. I think this is from Fred. Fred, there's a concern that you raised, saying that government, after Paul had spoken, then you said government wasted a lot of money making good roads in Karamoja. Doctor, you are really a doctor. And I want to emphasize that we have mothers in Karamoja that needs to be taken to hospitals using good roads. So you should not blame the government for working for the people, the mothers especially. The road is helping them to reach Mbale Hospital, Soroti Hospital, in case they have an emergencies. And I want to thank the organizers that we have learned a lot. Women are always left behind, but we're trying to see that they also brought to some page near. For example, I'm a woman representative. In a district, we have 1 woman and 2 males representing maybe north and south constituencies. So we are still behind. We are still not at that level. Everything which is done, we are just pushing it so that we are also seen as women. And down there, they're really suffering. Even if you look into employment, women are still not yet into. If you compare in a management rank, ladies and women are still not considered first before men, much as they qualify. As she's coming, I think she's telling me that we are time bad, but next time we shall still join you and talk more about what has brought us. I thank you so much.
Thank you very much. We've come to the end of our event. Evelyn already closed it, but I just wanted to ask the